So let's talk about health insurance. So there's two main avenues by which people get health insurance in the US. The first, which covers around 66% of Americans, is private health insurance. So usually this is from employer provided plans. So if you have a job, your employer will have some plans that they offer you and they cover some portion of the premium and then you may contribute some. And so the insurance that you get is through your employer. The other option, let's say, for example, if you're self employed or you're unemployed or you're for whatever reason not getting an employer provided plan, you can directly purchase private health insurance. And typically, this is done through the Affordable Care Act exchanges that each state has set up. So in California, Covered CA is the exchange by which most people that get direct purchase insurance will get their insurance from. And so the exchanges offer various private insurance options that vary state to state. And again, Covered California is for Californians. And so the advantage, or probably the reason why people use these exchanges, is because they allow you, if you qualify based on your income, to receive a partial or full subsidy for the plan from the Affordable Care Act, which is funds from the federal government. So if you buy your plan from the exchange, it will ask you some information about your income. And if your income is low enough, basically, you could qualify for a subsidy. I believe you can also buy insurance directly from insurance companies. But if you don't get it from the exchange, from what I understand, you cannot get the Affordable Care Act subsidy, especially if you qualify based on your income. So it is probably worthwhile to at least look at the exchanges and see if there's any plans that fit your needs. And we'll do that in another video where we kind of look at the Covered CA website and see what the plans look like on there. And as I mentioned, there's a sliding scale for the federal subsidy based on your income level and your family type. So if you have more people and your income is basically, if your income is X, if you're single, you may not get as much, but if you have a family on that same income, then you will probably receive more subsidy. So, there's certain factors that play into the how much money you get to subsidize the cost of the healthcare. Okay, the other way that a lot of people in the US are covered is through public health insurance. And so this is, the remainder, around 34% of Americans, but it's actually a much higher portion of the actual medical expenditures in the country. So it accounts for around 65% of the actual medical expenses. And why is this? Mostly because it's one of the schemes is Medicare, and so this covers seniors. So after you, I believe it's 65, will qualify for Medicare. After which, kind of the federal government pays a good portion of your medical expenses. There's different levels of Medicare, and so it could be that you pay some additional amount as a premium to the government, and they cover you even more. But basically, Medicare is a public insurance for seniors, and since seniors, just given their stage of life, um, they incur much more medical expenses than younger people. So that's why the public health insurance actually has more than the majority of the expenditures, even though it doesn't cover as many people. The other public health insurance is Medicaid, and so this is for low income people and children. So if you're really low income, you can qualify for Medicaid, which is administered by each state has kind of their division that will administer the Medicaid programs in the state. And from what I understand, actually, it's basically you'll just be fully covered through a Covered California plan if you're on Medicaid in California. I don't know this. I don't qualify, so I don't know this for certain. But from what I understand, you basically would pick a coverage option from the exchange, and the Medicaid funds would basically cover your entire premium. So you basically have private insurance, but it's just paid for by the state. Okay, and just one other note that I think is worth mentioning is what an HSA, health savings account, is. And so there are certain plans on the exchange that are HSA eligible. And so what that means is that these healthcare plans, if you choose them, will allow you to basically put money from your earnings into what's known as an HSA. It's a type of investment account. It's like a brokerage account. It's a account that you put money into, and you can buy stocks and other investments in that account that grow tax free. And even the amount you put into that is not taxable. So HSA is kind of a tax advantaged account, but the rub is that you can only use those funds for medical related expenses. So basically, what they're trying to get you to do is to start an HSA and put money in there and accumulate it so that when you're older, the investment, the funds they assume are going to grow just because you're investing them tax free. And by the time you retire, you'll have a good sum of money to pay for your medical expenses later in life, especially. So the one thing with this is that you have to have an HSA eligible health plan. And so again, in another video, when we look at the covered CA exchange, we can kind of see what those HSA accounts look like. Okay, so what does health insurance cover? And so we're just going to talk about the minimum coverage. So the Affordable Care Act, also known as Obamacare, it has listed essential health benefits. So every health plan that is available to consumers has to cover certain things, and these are called essential health benefits. So what are they? So we see here a list of all this stuff: emergency services, hospitalization, laboratory tests, maternity, newborn care, mental health and substance abuse treatment, outpatient care, pediatric services, prescription drugs, preventative services, and rehabilitation services. So they do cover these things, but the limits, as we talked about in a previous video, the coverage limits may not be like fully, like you may not have enough coverage in a kind of lower tier plan to cover, let's say, some experimental or a very expensive cancer treatment if you get cancer. So these things are covered, or for example, hospitalization. It may only cover you a certain number of days per year that you can be hospitalized. So all this stuff is covered, but the limits and all the details are variable amongst the plans. And so it's worth kind of exploring the details, especially if you're if you have some chronic illness or you are older and you're going to plan on using healthcare more. It's worth exploring the different kind of limits and coverage that you actually get. Even though it covers all this stuff, looking at the details might be relevant to you depending on your circumstances.